Hello guys, my name is Edgar Cabrera. I am from Caracas, Venezuela, and today we will talk about why do implants fail. Thank you to the International Association of Oral Maxillofacial Surgeons, specifically to NextGen, for the opportunity. This is part of my CV. I am oral maxillofacial surgeon from Lima, Peru, and right now I am living and working in Madrid, Spain. We have to start talking about the dental implants. A dental implant is a medical device designed to replace the missing root and keep the artificial tooth in place. It usually has a threaded shape and is made of biocompatible materials such as titanium, grade 4, grade 4, grade 5, that do not produce a rejection reaction and allow its union with the bone. It's very important to take into account the dental implant therapy concept. And this is a treatment that must have adequate surgical and prosthetic planning. And also, you have to do the controls, okay, to avoid the failures. You, as patient, have to take into account the control series. Right now, in our workflow, in our case, as maxillofacial surgeons, we take care into account. The most important part is the diagnostic evaluations and the correct planning and the study of anatomical structures that will support the final rehabilitation, which must have aesthetic and functional requirements. For that reason, we have to make the planning sequence, and this planning sequence start with you as patient must undergo a routine diagnostic tests that begin with a complete medical history, photographic records, laboratory tests, RX, the CBCT, OPG, intraoral scanning, surgery equipment, prosthetic equipment, and make all the successive controls, okay? It's very important. Recent studies have published a success rate in implant treatments around the 90%. Among the factors that influence the success and survival of the implants are the condition of the patient, the characteristic of the recipient site, the surgical technique, and the type of prosthetic rehabilitation. For that reason, when we talk about the surgical success, is directly related to a process of integration, as we call with the bone, as we call the osseointegration, but when the procedure has failed, an alteration occurs during the initial phase and a formation of fibrous scar tissue around or between the surface of the implant and surrounding the bone. For that reason, the implantology was described as a treatment that is performed in two different stages. The first one is the surgical concept. When we perform the surgical and we install the dental implants, we have to wait around 3 or 4 months, or we can apply a different concept, the immediate loading concept, for example. And the second part is when we perform rehabilitation, when the rehabilitation was carried out. For the reason, right now we have to review the contemporary implantology concepts, and is defined as a conservative rehabilitation treatment characterized by preserving intraoral structures, recovering the function of the stomatomatic system, providing immediate aesthetic and function maintained over the time. Here we have the periapical series. We perform a surgical extraction from the central incisor, install the dental implant, and we perform the immediate loading concept with the temporary prosthesis. And after 3 months, we perform the rehabilitation. Here we have the concept from the ITI, okay? We have different stages for the placement of the implant. We have the immediate implant placement, the early implant placements, and after that, the late implants placement. The difference between them is the time, okay? In the immediate implant concept, we place the implant in the same day as the tooth extraction. And the early implant placement, we wait around 4 and 8 weeks after the tooth extraction. And the last one are placed for more than 3, 4, and 6 months. We have the same concept for the loading protocols. We have the immediate loading concept, the immediate restoration, the early loading, and the conventional. Also here, the difference is the time, okay? The immediate loading are connected to a prosthesis in occlusion with opposing arch within 1 week, 7 days subsequent to the dental implants placement. For that reasons, dear friends, why do implants fail? The implants fail for many factors, can contribute to the success and survival and failure of the implant. But the main way of this is the condition of the patient, the surgical technique, the prosthetic protocols, and the controls of the patient. Okay, it's very important to take into account. Implant failures, when occur in the initial phase, and the treatment is caused by infections or poor biological conditions. After placing an implant, we distinguish an initial state that lasts about 7 days, 1 week, and that is the healing and the critical healing phase of the wound, caused after the insertion of the implant. Usually, it could manifest with inflammation, some pain, and in some cases with hematoma. After that, we have during the 3 months, 90 days of healing that the implant will need to join the bone, and some setbacks may occur in this phase. There is the possibility that the bone will not adhere to the titanium surface, and soft tissue will form, like the picture, between the titanium and the bone, avoiding the proper osseointegration of the implant. Complication in later stage, around 4 and 6 months, once osseointegration has occurred, and when we have occlusion, are due to misfit or fracture of the mini components or mini screw and infections. Here we have the causes: poor dental hygiene, smoking patients, infection related with irregular bones, advanced periodontal disease, extreme regenerative procedures when we perform this kind of surgery, allergic reactions, and other common cases. We have the smoking, for example. Elements like tobacco affect the osseointegration process. It's very important to review that. And the bone loss, we have the bone loss after the first years. This is the regular bone loss. It's normal to lose some bones around 1 millimeter, and we call that procedure the saucerization. But the control are essential to keep the implant in good condition and ensure that bone loss is not serious. It is important to note that bone loss may be due to trauma after the surgery, aging, or another disease, such as periodontitis. Overload, excessive forces of the implant caused by the way of biting or the design of prosthesis can affect your dental implant. And taking certain medication, okay, such as the biphosphonates, is very important. Here we have some cases. There is a case of periimplantitis. Here we have a loss of soft tissue and hard tissue, and it could affect your aesthetic and function. Here we have a case of infection around the implant, and here we have another case with the periimplantitis, and we can see here the implant, okay? It's very important, and we have different concepts. When we have failures, okay, the immediate loading of dental implant, this is an osseointegration failure. After perform an immediate loading concept. The second one, this is the immediate implant placement, and here we have an implant infection. This photograph is after an infection, and we have to remove all the implant and start again, perform guided bone regeneration, and just wait 4 months. And we can start again. This is the most important part. And when we have the conventional loading, we have overloading or excessive force, we can perform and we can see this kind of fractures of mini screw, and it could affect your health. The conventional loading, also, we have the periimplantitis, and this is all the tissue around the implant, okay? And these patients have mobility, pain, inflammation, and a lot of things we have to evaluate in consultation. But the principal causes of the periimplantitis in this example for you is poor dental hygiene, wrong prosthesis design, and lack of clinical controls. And the controls have to include the periapical series, the CBCT, and the intraoral records. And this is, can we see this kind of examples? This is the peri-implantitis, and we have all the mobility of all the restoration. And here we have to remove and restart again. We can make a brief like implant failure factors, and we have two different things. We have the exogenous factors and the endogenous factors. The exogenous factors are related with the experience of the skill of the operator, the surgeon, the periodontology, the implantology, also the biosafety conditions, the characteristic specific of your dental implant, the graft and protocol used. And the endogenous factors, we have the characteristic of the patient: bone quantity, quality, previous infection, periodontal condition, forces caused by prosthetic devices, and systemic compromises. We mentioned right now the smokers and no diabetes control and intake medications such as biphosphonates. For that reason, the prosthetic factor is very, very important, okay? The type and design of the prosthetic. But the most important part is the control of the prosthetic factor. If we have peri-implantitis, we can solve the peri-implantitis, okay? We can manage this kind of items. For that reason, we can perform the guided bone regeneration and restart again. Here we have the periapical series. This is the initial condition. After that, we remove all the tissue around the dental implant, perform with graft, we change the crowns and perform new rehabilitation techniques, and we have new bone. An implant is considered successful when a direct and structural and functional connection is established. It's capable of supporting normal and physiological loads without excessive deformation and without initiating a rejection mechanism. For that reason, when we have this condition, we can reset and start again. We perform the explantation of the dental implants and we make all the guided bone regeneration. We wait around 3 months, 4 months, and after that, we install another dental implant and restart the process. The take-home message for you, it's important to consider that the placement and evolution of the implant was successful, and the following criteria were taken into account. The first one, the absence of mobility, pain, absence of signs of radiographic radiolucency around the dental implant, absence or persistent irreversible signs and symptoms like pain, mobility, fractures, infection, paresthesia, for example. Having said that, the most important thing in that any of these alterations are detected in time to solve them, and that we can keep the implant instead of it. Prevention is the key to maintaining healthy implants in our mouth. My name is Edward Cabrera. Here we have my webpage, my Instagram, and my Gmail. Thank you. Pero. Ah, bueno, Gloria.
13 minutos. Está súper bien. Digo, está muy bien porque explicas todo muy